Welcome to Global Diabetes Insights, your go-to podcast for navigating the world of diabetes. I am Tino, a certified diabetes educator and a global advocate for non-communicable diseases.
And I'm Kona, a global advocate and a medical doctor. Together, we're your hosts, dedicated to raising awareness, fostering open discussions, and creating a safe space for everyone affected by diabetes.
Join us as we dive into empowering conversations with individuals living with diabetes, caregivers, healthcare professionals, and researchers. Our goal is to not only guide you through effective diabetes management, but also to inspire advocacy for proper healthcare access.
So get ready for a journey of insights, ideas, and diverse perspectives. Let's amplify our collective voice and create positive change. Get involved, get engaged, and join us in creating the change we need. So welcome everybody to Global Diabetes Insights. Welcome everybody to Global Diabetes Insight podcast. Together we have with us Alyssa today. Firstly, I would like to thank you for being here. I know you arranged your work schedule to be here. I would like you to introduce yourself.
Hi, my name is Alyssa. I live in Edinburgh in Scotland. I've had diabetes for nearly 11 years this year. And yeah, I'm excited to be here and share more about that.
Great. I know you're active locally in your country for diabetes technology, and I know a project called Diabetes Tech Can't Wait about the campaign, if I'm not wrong. I would like you to explain what this is about and what's your role in this project in advocating for access to diabetes technology.
So the Diabetes Tech Can't Wait campaign is a campaign that was started by our local diabetes association called Diabetes Scotland. And the purpose of the campaign is to get fair and equal access to diabetes technology for everyone in Scotland, because currently not everyone has access to it. A lot of the time it's based off of where they live and certain factors so I think you're more likely to get it if you're hypoglycemic unaware and some other factors, but not many people have access to pumps and CGMs or hybrid closed loops, these kinds of things. And it is very dependent on where you live. They started this campaign to try and make sure that the access to this was a bit more equal, spread about the population of Scotland. More people had access to it, so the criteria for accessing this technology was widened a wee bit. Also, a few years ago, we were given funding for access to diabetes technology, but that funding has just been sitting there because there's been no resources to implement the more people getting this technology. So just trying to make sure that the funding that is actually being allocated to it has been used appropriately. So that is what the campaign is all about. My role in it is kind of spreading the word about the campaign, sharing my lived experience of diabetes technology, because I've had diabetes technology for 10 years. I was one of the first people in Scotland to have a CGM. So I've shared my experience of it, how much it's helped me. I've encouraged other people to share their stories to try and lobby politicians. And we did actually get some extra funding to help implement diabetes technology throughout Scotland. So it has been a successful campaign so far.
So in Scotland, you have to meet certain criteria, which are not very realistic. If I'm not wrong, many patients, they have to show that they have many low blood sugars in order to assure access, or it's something that I just made up.
I don't know if they lie so much, because I think these days it's harder to lie about your blood sugars, because it used to be when we were first diagnosed, you have your diabetes diary and you write down your blood sugar. You can't really lie about that because most people have access to a Libre at the bare minimum, but you can upload blood sugar meters as well. It's just access to more sophisticated CGMs such as Dexcom or CGMs that link with insulin pumps or getting insulin pumps in the first place. These are the things that people aren't getting. So a majority of people have access to Libres, but a lot of the time it's children that are getting technology, not many adults. And then the adults do get it, they meet specific criteria. So like hypoawareness, or their blood sugar is the complete opposite way and they're really struggling with things on multiple daily injections.
Okay, another event that you have created is Young Fun and Type 1. I would like you to explain what it is about, how people can participate, what made you create this event, and what impact this has so far.
Yes. When I was growing up with diabetes, one thing I thought was it would be great to have an event where people my age with my specific problems, because being a young person with diabetes comes with its own set of problems, came together and just had fun. It wasn't always about diabetes, but you came and you learned together informally. That's what I would have loved to have as a child. So in 2018, I wrote a proposal and brought it to Diabetes Scotland and said, I would love to create this event called Young Fun in Type 1. And they said, yeah, absolutely, let's support you to run this. So it was an event for young people aged 16 to 25 living with type 1 diabetes in Scotland. At it, there was some fun sections, so there was some acting, exercise, there was lots of different things, but there was also some diabetes education. And the purpose was just to create a micro community within the wider diabetes community in Scotland of people. They could get peer support, but they could also just have fun. So that was the purpose of it. So it ran in 2018 and 2019, and then it was due to run again in 2020. There was unfortunately a pandemic. So I decided that there's already so many online communities. I didn't want to make it an online event. I wanted to have it in person. That was the purpose of it, having in-person peer support for young people. And so hopefully this year we're going to bring it back. We're going to widen the age range because I'm 25 now, so I'm at the top of the age range. So
I was about to say that I was excluded now.
yeah, hopefully I'm just trying to procure funding for that to figure out how it's going to run, and it's going to look a wee bit different now, but I'm very excited because I think I'm going to have even less of the diabetes aspect, more of just the peer support and having a fun day with loads of fun activities. That's what we're looking at. But it was really a great thing to run 2018, and so maybe like 20 when I decided to run it. So it was a great thing. In 2018 in Scotland, there was this thing called Year of Young People. So it was great because there was a focus on getting events out for young people specifically, and so I had a lot of support when I first started it. So I'm hoping that that legacy will help me run it this year when I finally figure out how it's going to run.
Yeah, I wish you good luck with this year. We have hosted so many people in this podcast, and everybody agrees to the importance of peer support in the diabetes community. It's so essential. I didn't have it either. I still don't have it. I mean, I have it online in communities, but locally, I don't have a group where I just can be my diabetic self unapologetically. That is so core. It's like we are diabetic co-workers. So we share what we are going through, hidden part of our life, especially in younger ages when we may feel more isolated, because I also couldn't easily express or communicate with my peers, explaining what diabetes is, what I'm doing, why I'm injecting, why I have this stress, why everything. Having people at the same age experiencing the same thing, it's so healing and so deeply important.
It's so healing to be around people and feel normal. So being able to do activities and then not have to apologize because your blood sugar is low, because everyone understands that that's just part of having diabetes. It is so healing, I think.
Yeah, or not feeling uncomfortable to drink juice or to have that alarm beeping in your device.
Yeah, because you'll know that if your device beeps, sometimes you already know that you're slightly high and you don't have to action it. So if you ignore your alarm, you know that you're fine, but everyone who's not diabetic will be like, oh my gosh, are you okay? But when I'm around my diabetes friends, they just ignore it as well. They know that if it was urgent, I would deal with it. So it's really nice to have that community, and that's what I'm going to try and set up more this year.
Great. I also know that you're involved in healthcare providers training on engaging with young people with diabetes. What motivated you to take this role, and what key insights did you share during the training sessions? I know that in some way, every diabetic person wants to be involved and engaged in the diabetes field, whether is that in the field of advocacy, in the field of healthcare professionals training. I know that the diabetic experience is so hard. We need our healthcare providers to be informed. Can you explain this experience?
Yeah, absolutely. This was actually a few years ago when I was a wee bit younger, and I would have been in that transition age between a child and an adult. There was a group of us. It was like a youth group run by Diabetes Scotland, and we came together and thought, okay, we don't think the healthcare is good enough. There's healthcare for children and there's healthcare for adults, but the healthcare professionals don't really know how to engage effectively with young people in this transition age. And so there's a high drop off in care and people not engaging in healthcare. And that's a big worry, because that's when young people really need the support, is at that age. So we created a training program. So it was training that was created by young people for the healthcare professionals and delivered by the young people people themselves, which I think is really essential, because then they can share their lived experience more effectively. So we created a training program just on different methods of how to engage with young people, meeting them where they are, not always assuming the worst, making it a lot more informal, because healthcare settings are very formal, they're intimidating, and diabetes is already intimidating enough. We don't need any more barriers to this engagement, and just making sure that the language is appropriate, so you're not using too much medical jargon, you're making sure you're talking about their lives rather than what you want their life to be. There's no point going in saying you need to be changing your life so drastically. They're not going to do that. You need to make changes in small steps based on what they're experiencing in their life. So there's lots of small things that we did, but it was really great because a lot of the healthcare professionals just said, no one's ever explained it to me, and from that perspective before. These are things that I know, but hearing about experiences of bad practice from people who've experienced a bad practice is such a enlightening thing. So it was actually really great training. It was called Making Connections, just so that the healthcare professionals could make connections with the young people better. It was such a great experience to be a part of, and it's something that people have brought up to me before, just in passing, saying, I would love to do this kind of training with healthcare professionals. And I'm like, we actually did that in Scotland. So it's really nice.
Were healthcare professionals overall open to hearing from you? Because healthcare professionals do tend to have a feeling that they know everything and they don't need further information.
I don't know if they're not open for further information. I think the problem is that they're so busy that they don't have the time to change any of their practice. It's just business as usual. So we travelled to them and did the training in their location so that they didn't have to travel and leave their busy work life for too long. But a lot of the time it's just there's one good healthcare professional who gets us in, and then we get to go and convince the rest of them. And at the end, normally they all are like, yeah, that's really good to know. But I think we need to remember that healthcare professionals do go into their job truly wanting to help and make a difference in people's lives. No one goes in and thinks, I'm just doing this for the money. It's a profession that you have to have some level of empathy, and they truly want to do what's best for their patient. So it's just making sure that there's no barriers to training and there's no barriers to changing their practice, I think.
I totally agree. We have to remember that the workload of healthcare professionals is pretty much, and they tend to do things mechanically, not because due to lack of empathy, but mostly due to lack of time. And I would like you to share with us the significance of your involvement in the local youth project. How was that achieved, and how do you believe that such projects help with raising diabetes awareness?
So I've been involved with the Diabetes Scotland Youth Project since I was 16. So that was maybe 8 or 9 years I've been involved in it, and there's been various different projects within that. Firstly, it's just how empowering it is to be around people who are experiencing the same things as you, and it's just the peer support that's so important. And we've already mentioned peer support. Everyone knows that. I think it's really important. Just having the confidence to know that everyone and diabetes is different. So when people in your everyday life question you, you could be like, okay, well, I know that your sister's son does it differently, but this is how I do it for my body. It's having the confidence to know that just because someone else does it differently doesn't mean you're doing it wrong. I think being in youth projects like that is really important for that. It truly made my confidence soar, just knowing that, yes, my life looks different from someone else. Other people don't understand how different diabetes is, but that doesn't mean I'm doing it wrong. I think it is so great to be around so many different people with such different opinions and skills. So there was a project, we called it Just Duck It. Duck stands for Diabetes UK, so it's DUK, so Just Duck It. And we created a platform by young people for young people. I don't know if it's live anymore, but we created a whole website full of resources. But not only was it great to have those resources and be a part of creating it, it gave me so many skills, like building a website, building partnerships with different people. It's great to see other people thrive. These are things that we can use on our CV for the rest of our life. These are personal things that I think it benefits, but obviously it benefits other people. But it's also seeing other people use their voice that I think is important. So many people have lived experience stories that you wouldn't hear ordinarily, and seeing other people share their stories encourages other people to share their stories and do advocacy work. I've just been around so many different amazing people through this, because over the 9 years there's so many different people came in and out of it. It's just such a confidence builder, I think. And even if people go to it and decide, actually don't think I want to be an advocate, they then have lifelong friends from it that they can take away outside of the advocacy work.
I always say that I'm so happy when I see people with diabetes being active about diabetes, because if we don't speak up about ourselves, nobody will. Also, diabetes is such a hidden disease that people think that, especially diabetes type 1 and this misconception with diabetes type 2, that people do not understand the struggle. They think that we just take insulin and everything is okay. Just measure our blood sugar, which always is okay. And if we got high blood sugar, it doesn't mean something, or we don't have symptoms. And explaining what that means for us, it's so important and essential for us to do it if we have the courage. Not only
But also,
to...
I think, sorry, just to add on
No,
to
it's okay.
that, I think not everyone is made to be an advocate and to share their stories. Not everyone wants to do that, but by some people sharing their stories, it impacts on some individuals more than we even know behind the scenes, and might make their day in life a lot better in ways that we won't even know. I think some people sharing for other people that can is really important as well.
Yeah, of course, it's not about pressuring everyone with diabetes. Talking about diabetes is about bringing diabetes into the light. And so what does mean for us? For example, normally, I think that every diabetic should have more days off from work due to diabetes burnout, emotional distress, physical distress. I totally agree with what you say with the hidden impact, because once I was studying for my university, and I got a message on Instagram, a girl I didn't even know. And she was like, I saw you gave an interview and I wanted to thank you about talking and sharing your experience. And I was like, okay, there are so many people who are seeing what we do. They receive answers or they receive support, and we don't even know it. It's important to keep going and know that this helps the diabetes community, the people who do not have diabetes, to understand what diabetes is. So I congratulate you for being such an active person. Personally, I struggle by having only diabetes as a medical condition. And I know you don't have only diabetes. You have another medical condition which interacts with diabetes in a very mysterious way. And you have epilepsy, if I'm not wrong.
Yeah.
Which is triggered by low blood sugars. And low blood sugars is a fear that I think almost every diabetic has. In your case, I feel that the fear of lows is even higher, because you know that is a possible trigger to your other medical condition. I would like you to share with us your thoughts and how you control this insecurity that these two diseases bring in your life, and how you manage to control it, or how you have experienced maybe a really bad low sugar with epilepsy crisis at the same time.
Yeah, so I got diagnosed with type 1 diabetes in 2013, but I got diagnosed with epilepsy in 2010. I was having low blood sugars that led to seizures for a few years before they realized that the reason that the low blood sugars were causing seizures more often was because it was epilepsy. So it took a wee while for me and the healthcare professionals to make that link. It just seems like a very unfortunate interaction, because the reality is I have type 1 diabetes, and low blood sugars are almost an inevitable thing. If you have a blood sugar in range, it's very easy for blood sugars to slip down. The first thing that I make sure I do is my range is set a tiny bit higher than most people, just so that I don't go into the danger zone, because I have had a seizure when my blood sugar was only 3.8 before, which is not low at all. So normally I run between 5 and 10, just so it's a tiny bit higher, and it means my graphs look slightly different than a lot of people's, which sometimes is hard to see, but that's just my reality. I'd love to tell you, because I use a CGM and an insulin pump to control it. I use the closed loop and a half for a while, because you have the safeguard, it suspends your insulin. But one time I was on a diabetes camp when I was 16. We went swimming. There was a big swimming pool and it had water slides in it, but you can't bring your insulin pump with you when you're on that. You can't see what your blood sugar reading is. So I was away from my insulin pump we decided to go on the water slide. I was waiting in the queue for the water slide. I started to feel hypo, but the bottom of the water slide was actually closer to my pump and the sugar than the top was, and then I'd have to walk longer. So I was like, okay, I'll just go down the slide and then I'll treat it after. But I never made it to the bottom conscious. Halfway down the slide, I had a seizure. Unfortunately, it's what you call a tonic-clonic seizure, which is a full seizure, so you're unconscious and your body's jerking. I had to get pulled out at the bottom by the lifeguard. Thankfully, the lifeguard saw that I hadn't come up and then jumped in and pulled me out. And they had to call an air ambulance because they thought that I could have breathed in water while I had the seizure. Luckily, I didn't. And although the air ambulance was called, I unfortunately never got to go in it, which would have been quite cool. But so everyone was freaked out because apparently, even though it's a diabetes camp, nothing like that has ever happened. And it was really scary because I literally could have died that day just because I had a low blood sugar and seizure. And I think sold to everyone how scary hypos can be. And you know, they don't normally let you go to that camp 2 years in a row, but because I'd had a bad experience, they let me go the second year as well. And I had another hyposeizure on the bus. And it's just because we were doing so much more physical activity the whole week than I was used to. I just had a hypo, which is kind of inevitable when you increase your physical activity. But I just have to be so much more aware of if I'm going to be doing more exercise or if I'm going to have hormones that week, if I have a wee bit more insulin, like what factors affect my diabetes so that I don't go low and I can prevent it in advance. So I just have to plan my life a tiny bit extra. But yeah, it's extremely scary. I've had a lot on public transport because I'm not allowed to drive because I have epilepsy. It used to be like even going on a bus by myself was quite scary, but I live very independently, mostly thanks to diabetes technology.
I admire your courage to have in balance those two conditions because personally I struggle with the fear of lows. Even if I don't have a low, seeing that I'm near to having a low, I feel the symptoms of low blood sugar. In order to avoid low blood sugars, especially when I'm at work, I tend to have high blood sugars, which is such a mistake. So knowing that a low blood sugar may trigger something else, which is more dangerous than just the symptoms of low blood sugar, is really difficult to balance. What you said that you have a higher limit of low blood sugars is like a tip to anyone listening that might have the same condition as you. The whole story you shared underlines the importance of diabetes technology because if that was a decade ago, we would just guess what your blood sugar is, what your blood sugar tends to be, like the arrows that we couldn't see. I know that the core of your advocacy in your country, but also generally, is diabetes technology. I would like you to explain which features of diabetes technology suit you best in controlling diabetes and epilepsy. For example, for me, I cannot use a closed loop because I tend to underestimate the way the pump thinks. I trust only myself, so I cannot rely on a closed loop. I cannot do that because I'm so stressed about taking the right decision. We talk about diabetes technology, it does not take the factor of epilepsy into account. So you have to manage it. So yeah, I would like you to share what works best for you and how you manage to interact with your machines and your body.
Yes, I totally understand what you're saying about diabetes technology and hybrid closed loops being quite scary. It takes some of the control away from you. I use a tandem T-Slim and a Dexcom to control my diabetes, and so that does have a hybrid closed loop. Unlike Medtronic
So
and
it is a closed loop.
yeah.
Okay.
Yeah, so unlike Dexcom and Omnipod, which changes background insulin based on the days that have come before, it kind of learns your routine. This one has basal profiles similar to if you didn't have a closed loop, and then it adds extra insulin or less insulin on based on what your current blood sugar is. And I think that works better for me because my lifestyle changes day to day quite a lot. So I do a lot of exercise and stuff. I rely heavily on the closed loop, so I try and trust it as much as possible, especially for the safeguard. So that's just when it's going lower and it suspends your insulin, that is when I rely on it the most. But also I just think this system worked really well for me. It just means that I'm not afraid to go out by myself and do things myself. I think the hybrid closed loop in particular has given me a lot more confidence to just live the life that I want to live. I live in a very walkable city, so I walk everywhere, and it just gives me the confidence that if I go out for a walk, my blood sugar won't drop, or it will alarm me in advance that it is dropping, and it won't get to that stage. But you can also change your limits. So obviously I've went in and I've said, don't try and bring me that low, bring me to 5 is the lowest and under 5 is hypo. So that's what it does for me. Because I am scared of going low, I would go high quite a lot. Now that means that I don't go high as much because it's automatically bringing me down. It's kind of curbing my anxiety highs a wee bit more, but they were a big problem. I was just so scared that I was going to go low that I was going completely opposite way. And then when your blood sugar's high, I'm less likely to correct because I'm so angry all the time or upset. So I think technology has really helped me.
I know that Advocacy Scotland is quite active. I would like you to share with us what are the biggest problems or challenges people with diabetes face in Scotland, and what would you like to achieve as an advocate and also as a diabetic citizen in this country for the future?
First of all, I'd just like to say how incredibly privileged we are in Scotland. We are in a very privileged position because we have the National Health Service, or the NHS, and it's also devolved from England, so we have a slightly different healthcare from the rest of the UK. But we have free prescriptions, so we get all of our healthcare and our prescriptions for free. So a lot of the issues that we're advocating for, they're coming from a privileged place because we already have access to the basic. Some of the things that we're advocating for are access, fair and equal access, so that everyone can access the vital technologies. Because it is a free healthcare system, the waiting lists are often really long and hard to access. So it's just making sure that everyone has appropriate and timely medical care. So a lot of the things we are advocating for are definitely coming from a place of privilege, but it all comes down to money. The National Health Service doesn't have enough money. So if you're an inpatient in the hospital, for example, they won't know anything about type 1 diabetes. The policies aren't there to safeguard people with type 1 diabetes in hospitals, changing the policies to keep people with diabetes safe. And I only know this from a type 1 perspective because I don't know anything about any other types of diabetes, just to be clear. But I've been an inpatient in hospital before for something completely unrelated to diabetes. I was extremely let down by them because obviously I can't go hypo, and they just left me going hypo for almost half an hour while they tried to figure it out. So I advocated for changing in policies for inpatient care for type 1 diabetes, and they ended up changing the policies based on my experience there. So these are the kinds of things that we're looking to change, and it is an extremely active community. There are lots of us. Thankfully, it's such an extremely supportive thing to be a part of, and I think right now we're just trying to get more money for type 1 diabetes care because it's all about prevention rather than like action when things happen. So right now there's more money spent on diabetes complications that could have been prevented if there was adequate care from the start. For example, access to diabetes technology, and the research is there to show that if money was spent up front, there would be less money spent down the line. But I think the problem right now is there's no money right now to spend up front to make these changes. So we're just trying to get money out of nowhere to make these changes right now. That's the main thing that we're trying to do. But yeah, I'm really thankful to be in Scotland and to have such a great community and also be in such a privileged position.
Prevention is always cheaper than treating the complications. Not investing in prevention is like ignoring the possible complications. So it's like a disrespect to the patients because every diabetic should have access and the right to live a life as close as possible to a person without diabetes life.
They should have the right to live the life they want to live, no matter what they're doing. But we've spoke to doctors, we've spoke to politicians and people who hold the money, and they just said, sorry, we understand that, we know the research says that, but we don't have any money right now to do that. And I'm like so frustrated because everyone knows that prevention is the best way forward, but it's not happening.
Yeah, like even healthcare systems are going to suffer from untreated patients with diabetes because it's an ongoing disease and it brings up so many complications if it's not working well. Where are you from? What job you do, what your social status is, should not define your access to treatment. This should be underlined. It's not given globally. It's sad, but we will keep advocating for this.
A lot of places are still trying to get access to the basic and can't look further than the basic until that's sorted. So thankfully we are looking at how do we make sure the socioeconomic class doesn't impact your diabetes care about rural areas, because Scotland is a very rural place. So how do they get access to care and just these other issues that we can now focus on because we mostly have access to the basics.
Yeah. Thank you very much for being here, for sharing your story, for representing your community in our podcast. I wish you all the best with your life, with diabetes life, with your work life. Hopefully we will meet, I don't know, in the Diabetes Scotland gathering. I promised to Jean that I will try to come.
Yeah, that will be great. Hopefully see you there. It was lovely to meet you.
Have a nice day.
You too. Okay, bye.